Most people think the most dangerous animal on the planet is a shark or a tiger. They're wrong. The real threat is much closer, smaller than your fingernail, quietly living around you. You've probably been bitten by it multiple times this week without even thinking about it. But one specific bite can change everything. Just one bite from an infected female Anopheles mosquito is enough for things to turn serious, even life-threatening. So what exactly is this disease? And how does something so tiny become this dangerous? Let's understand. What is malaria and how it spreads? Malaria is a serious but treatable disease that is caused by tiny parasites called Plasmodium. This parasite then enters into your body through the bite of an infected female Anopheles mosquito. After the bite, the parasite travels to the liver, where it multiplies silently. Then it enters the bloodstream and begins infecting red blood cells. That's when you start noticing common symptoms like fever, chills, sweating, headache, and body aches. Since the early symptoms of malaria are often mild, it can easily feel like a normal fever, which is why many people tend to ignore it at first. But malaria doesn't always stay mild. In some cases, especially with more severe types, it can become life-threatening within a day if not treated on time. Now let's talk about how it spreads. Malaria spreads mainly through the bite of an infected female Anopheles mosquito. When this mosquito bites a person who already has malaria, it picks up the parasite, and when it bites another person, it passes the parasite into their bloodstream, continuing the cycle. Moreover, it does not spread through casual contact like a cold or flu, but in rare cases, it can be transmitted through infected blood, such as unsafe transfusions, shared needles, or from an infected mother to her baby during pregnancy. Symptoms of malaria. Some of the early signs of malaria include fever, chills, headache, sweating, body aches. These symptoms usually appear within 10 to 15 days after an infected mosquito bite and can feel like a normal viral fever, which is why it is easily mistaken for a common viral illness. Furthermore, in more serious cases, symptoms can quickly become severe. This includes feeling extreme fatigue and tiredness, confusion, difficulty in breathing, repeated vomiting, abnormal bleeding, seizures, or even dark urine and yellowing of the eyes and skin. These are clear red flags that need immediate medical attention. Additionally, infants, children under 5, pregnant women, and people with HIV or AIDS are more vulnerable and face a higher risk of severe malaria and serious complications. Prevention tips. How to prevent malaria. The good part is, malaria is preventable, and it mostly comes down to simple habits. Start by avoiding mosquito bites. Use mosquito nets while sleeping. Apply repellents, especially in the evening. Use coils or vaporizers indoors. Wear full sleeve clothing. Keep your surroundings clean and free from stagnant water. And if you're traveling to high-risk areas, it's smart to check with a doctor in advance. Preventive medicines like chemo prophylaxis may be recommended based on your destination, the type of travel, and how long you plan to stay. There are also malaria vaccines, such as RTSS/AS01, recommended for children living in high-risk regions. How malaria is treated. Once malaria is confirmed through blood tests, either by microscopy or rapid diagnostic tests that give quick results, treatment usually begins right away. Doctors choose the right medicines depending on the type of parasite, the patient's age, and how severe the infection is. Some of the most commonly used medicines include artemisinin-based combination therapy, ACT, chloroquine, and primaquine. Malaria continues to be a serious global concern, with an estimated 610,000 deaths reported in 2024 alone. That's why acting early matters more than anything else. If you notice symptoms like fever, chills, or unusual weakness, don't ignore them or wait it out. With Visit Health, you can connect with qualified doctors, book diagnostic tests, and even get medicines delivered all in one place. Take action early, because the right care at the right time can make all the difference. It's obvious. Get Visit.